Recession of the gum around a tooth usually is a result of loss of bone on the facial side of the tooth and can result in an unsightly appearance either around a crown or on a natural tooth. There are two types of gum tissue in the mouth. There's a thick band of attached tissue around the neck of the tooth, which is firmly there, bound to the bone underneath and very protective of that gum line. And then a looser, thin tissue, which is called mucosa, out onto your lip or your cheek. Now, you can lose that attached tissue for a variety of reasons. You can brush too hard with a hard brush or a soft brush. You can have orthodontic treatment that may move the tooth inadvertently out of the bone, and as the bone recedes, the tissue will recede with it. Or it doesn't have to be because of orthodontics. It could be due to the fact that the tooth erupts ectopically through the bone on an angle, and perhaps may be down when the tooth first erupts and then may proceed after that. You're only supposed to see the enamel of the tooth. And generally, once you see the root, that's true recession. And in many cases with gum recession, some people have a sensitivity on the root surface. Perhaps it's more difficult to brush because the tissue that's mucosa, if you've lost the attached tissue, can be sensitive during brushing, even routinely. And sometimes there's a little bit of a sensitivity to air when you breathe in. So the root surface may also be a little darker, and that's unsightly in certain aesthetic areas. So those are some of the symptoms for gum recession. In many cases, the solution is more reparative and regenerative. We can sometimes bring attached tissue up over the root surface to do two primary things. The first goal is to stop that recession so it never goes any further. And by doing that, you're preserving the remaining bone on the facial side of that root, because as it recedes, it takes the bone with it. And the second thing is to try to cover that root. If we can cover that root for an aesthetic outcome, all the better. So having an evaluation for your mucogingival problems is something that a dentist would provide and a periodontist can certainly offer solutions for.